Hello and welcome to the Leahy Hospital and Medical Center Pain Pump Peripheral Nerve Catheter teaching video. Your provider has ordered you to go home with a temporary pain catheter to assist in pain management after your surgery. The purpose of this educational video is to provide you with ongoing guidance when managing and caring for your pain catheter. Your pain pump has a local anesthetic infusion that will numb a targeted surgical area on your body. Local anesthesia has been used for many years successfully for surgical pain control. This will help lessen the need for narcotic use after surgery. The pain pump will be placed by your anesthesia provider and securely taped in place on the day of surgery. Once in place, there should be no pain from the catheter itself. The pain pump will be used for 3 to 4 days post-operatively while you're at home recovering. A phone number will be provided to you to contact the Leahy Anesthesia Department directly with any questions or concerns. We will now review all equipment associated with this device. The local anesthetic will be located inside the softball-shaped medicine pump. A convenient carrying case will be provided for easy over-the-shoulder use. The pump tubing will connect from the medicine ball to the catheter that is inserted into your surgical area. On the pump tubing, there is a rate controller, a small filter, and a white clamp. The rate controller will be set at a predetermined rate by the anesthesia provider. The rate number will appear in the window on the controller. The dial key that attaches to the controller will be removed prior to your discharge and placed inside the carrying case. The anesthesia provider will guide you through changing this rate number, if necessary. Otherwise, do not make any changes without talking to the anesthesia provider. The clear cover over the rate controller should be closed completely, and the rate controller should remain outside of any clothing. The filter on the tubing should not be taped or covered. The white clamp on the pain pump tubing should remain open to ensure the medicine is flowing properly. Clear tegaderm dressing will be placed over the catheter insertion site. Please reinforce the dressing if the edges start to roll. If the catheter site itself is exposed, do not reinforce and call your anesthesia provider. The tubing should hang freely to prevent any disruptions in the infusion flow. Showering is not permitted. The pump and the catheter should be protected from water. Please keep the area dry. The pain pump will infuse automatically. Please do not squeeze the pain pump. Over the next few days, the ball will shrink as the medication is delivered. If you start experiencing any increase in pain, ensure that the tubing is not kinked or the white clamp is closed. Follow the tubing from the pump to the insertion site to assess for any kinks or leaking areas. Also, ensure that the number on the rate controller is correct. The pain pump may cause some numbness or loss of feeling in the surgical extremity. This is normal. Please be careful when using heat or cold therapy to prevent skin irritation. Please contact your provider if your extremity becomes pale, cool, or excessively swollen. If you develop any of the following medication toxicity symptoms, please clamp the pain pump tubing immediately and call your anesthesia provider or 911. These include blurred vision, ringing in the ears, metal taste in the mouth, numbness and/or tingling around the mouth, fingers, and/or toes, drowsiness. If you develop any shortness of breath, please call 911. If you develop any of the following catheter symptoms, please also clamp the pain pump tubing immediately and call your anesthesia provider or 911. These include increase in pain, fever or chills, redness, warmth, bleeding or leaking, swelling or bruising around the catheter site. The anesthesia provider will review when it is time to remove your catheter from your body and discontinue the infusion. We will now review how to remove the catheter. You may want a second person to assist in your removal. First, wash and dry your hands thoroughly. Next, close the white clamp on the tubing. Next, find the end of the clear tegaderm dressing and peel it back to expose the insertion site. Grasp and gently pull the catheter out. Do not pull hard. If there is any resistance, stop pulling and call your provider. It should remove easily. The end of the catheter should be black in color. Please call your provider if the black tip is not seen. You can cover the insertion site with a Band-Aid, but this is not necessary. The pain pump and all the tubing can be disposed of in the regular trash. We hope this educational video was helpful and informative. Please call with any questions or concerns.